Welcome to Healthcare Musings, a podcast dedicated to the discussion of critical care and healthcare in general. Here's your host, Dr. Hesham Hasabala.
All right. Thank you, everyone, for being here. Happy to have you with me. I am very delighted to have on the show today Mr. Dominic Kayata. I hope I pronounced that last name correctly. And I will let him introduce himself.
Great. Thank you, Dr. Hasabalo. As mentioned, my name is Dominic Kayata, and I serve in the role as Senior Director for Patient Experience for a healthcare organization. And as part of those functions, I oversee the patient advocacy function for that organization.
Okay, wonderful. Thank you for being here. Very, very happy to have you.
Thank you.
Dominic Kayata, very sorry that I mispronounced your last name.
No, that's fine.
So he and I were involved recently in a case, and I want to kind of have him just kind of describe what happened and what led to he and I being involved together, and then that led to this podcast episode. So take it away.
I appreciate that, Doctor. Yes, we had the wonderful privilege of meeting with a daughter of a patient that unfortunately passed away. Also present was her spouse. And it was one of those situations where the mother did have some health concerns, and the daughter was, very cognizant of that fact and, had everything in perspective. But what brought them to the emergency room that night, there was a lot of, situations here that obviously the daughter was very concerned and not had seen her mother in this state before. And unfortunately, as you can imagine, with all emergency rooms currently facing in the nation is at capacity, long waiting times. And unfortunately, that was the situation for this daughter and her mother that evening. And, she is a wonderful patient advocate for her mother, as we're going to talk about as part of the debrief and for this podcast. And she kept going to the registration person in the ED to kind of see when her mother was going to be seen, because she felt her mother was really in distress and things were not happening as quickly as possible. Finally, they were able to do some initial assessment and then bring her back. And unfortunately, the situation worsened for this patient, who happens to be, the mother. And again, the daughter, knowing her loved one inside and out, was just very concerned. When they finally got to the back, she noticed again some changes in her situation, and please correct me if I'm wrong here, Dr. Hasabella, she noticed some changes in her extremities, like in the lips and fingers starting to turn blue.
Right.
She was, had never seen her mother in this state before, and, just really laboring to the point of, really hard to breathe. And again, trying to get people's attention to say, hey, we need some help here and some serious attention. Well, unfortunately, things turned to worse, and the doctors, came around to intercede, and basically, without going into too much detail, realized they had to make some very hard decisions and very quickly. And that process began, and they were then going to be in the process to transfer their loved one to the ICU because it was becoming that serious. And as part of that process, had to do some other consultations that were happening. And, given the state of, healthcare, sometimes we have to think outside the box to provide coverage 24/7. And they had to actually do a televisit with another specialist to be able to assess the situation and, making sure we were thinking about the situation correctly for the, family to make the best decision. Well, they've already made that decision. And then the doctor who was on site insisted on this televisit and basically put a computer screen up to the patient and the family and began discussing all these potential options. Now, here they thought, as Dr. Hasabella and I will talk about in the course of this family meeting, to review everything that they experienced and their perception of the care, how the communication went down. Now they're talking about other options. And this left them very confused because over the course of the last 2.5 hours, they had to make that hard decision to not provide any type of heroic measures at this point because they knew that would be their mother's wishes, and they wished to honor that. Plus, they saw the extreme suffering that she was going through. So this left them confused, hurt. Were they making the right decision after this discussion happened by somebody over a computer screen, if you can imagine? Well, they had made the decision at that point, and luckily there was a nurse there that they had some familiarity with, and he tried to walk them through what would happen once they started removing care from the situation, of what would be the timing with that. And even though they were hurt, confused, and stymied by these other specialists getting involved and perhaps offering other options, they knew that would be the best thing to do, and they did remove care. And things progressed from there, and their loved one, in this case her mother, did pass away.
Yes, thank you very much, Dr. Dominic. And we, just so everyone knows, the family gave us permission to discuss her mother's care. Yep. And what happened. And I think what struck me, and I wanted to get your sense of it, I have, as a critical care specialist, I've faced situations like these ad infinitum. I can't even recount to you how many times this has happened to me. And what really was striking for me in listening, and I was there in my capacity as medical director, as regional medical director, because that's one of my roles. And just you don't really get a lot of times the perception of the family. And this was very traumatic for her daughter, the patient's daughter. And it took a lot of courage for her to come and relive the moments. I mean, it was not even 2 months before. Yes. And it was very difficult for her to relive those moments. And but she wanted to do it not to get retribution or revenge, or even, she said she wasn't even looking for litigation. What she wanted to do was to make sure no other, and this was really remarkable, that no other family goes through what they went through. And just from and the things that she described, like, for example, there was a time where one of the caregivers had kept trying to get a blood pressure and it wasn't working because the tubing wasn't connected. And I could see myself, and the care person laughed at that, but it wasn't funny to the daughter, right? Yep. And because I can see myself laughing at myself. Oh my God, I can't believe I didn't connect it. You didn't connect the tubing, and I would laugh in that situation, but it wasn't funny to the family. And that perspective was really, really eye-opening. Also, something that happens a lot, and I hate to say it, patients are in the course of critical care and critical illness, patients are exposed. Yes. Their bodies are exposed. And as this patient was being transported, her body was exposed, and no one paid attention, and everyone was laughing again. And she noticed that, and that was very traumatic for her. And she said, please, I can't remember if she told them that, but she wished that they would cover her up. Yes. just to preserve her dignity. And she understood that we need release, emotional release. And at the same time, it can be perceived as very, very callous and heartless if we're laughing and joking and your mother is literally lying on the bed dying. And I think that was what that struck me the most, is that how we are perceived by the family, and how important it is that in a situation where a family member is dying, that we really have to be so much more sensitive to the experience of the family. right? What do you think, Dominic?
Oh, you couldn't have said it more beautifully. And I know we debriefed right after that very, intense but so eye-opening and enlightening meeting that, not only do we offer our patients a dignified and comfortable death, we also owe that to the family because they're the ones that are kind of left here without their loved one. They are trying to protect not only the dignity but the legacy of their loved one, and to
Mm-hmm.
watch what occurred in this one in terms of some of those joking behaviors. And they even did mention here they are making a hardest decision you can imagine here for a loved one when you're entrusted with their care, and to see people out at the nurses unit, maybe watching videos or laughing. And again, the family was so respectful and you know courteous of, hey, they get it that staff need to relieve the tension once in a while, but there's a time and place for that, and that can never happen on the medical unit, especially an eye shot or ear shot of not only the patient but then the family who are grieving the inevitable loss of their loved one.
Yeah, I mean, that's it's so important. Like I mean, when I'm on shift, I'm frequently on the unit, and I'm joking with the staff
Yeah.
because I think staff camaraderie is really important.
Yeah.
I'm the medical director. I really want to connect with the staff, and I want us to have a good working relationship. And I just don't think we pay attention to enough to the experience of the family. And I lost a child. I lost a child to cancer. It'll be 15 years next month.
Mm.
And I had a different experience with the loss of my child. I'm still in awe as to what the staff did when they transferred her to another institution, a higher level of care. And there must have been 12 people in that room, and people stayed after their shift to help my daughter and take care of her. And ultimately, she passed away the next morning. And
Mm.
still, if I had the experience that this daughter had with the death of my daughter, I would still be mad to this day.
Mm-hmm.
And I was very blessed that I did not have that kind of experience. And
Yeah.
then like you said, once they made the decisions that continued aggressive care was inconsistent with the patient's values and preferences, to then go back and say, wait, there's more that we could do, I think was devastating. What do you
Agreed.
Yeah? I mean,
Totally agree. It's hard enough a decision, and that, like we just talked about, the family wants to respect their loved ones' wishes, even though it might not be their own. They see them in this state, and they just want something done. But to your point, it just really adds salt to the wound in a hard decision that was already made, and they were dealing with the consequences of that decision.
and yeah, and I mean, like so many families deal with guilt,
Yes.
the guilt of letting their loved one
Oh,
go, of not doing everything,
yes.
of not escalating care.
Yep.
And even though I think it's the right decision, I don't disagree. I think
Yep.
it's the right decision, and still I try to make it a point to relieve the family of guilt and tell them that the burden of grief is going to be enough. Do not bear a burden of guilt. And so to go and I'm not necessarily criticizing the colleagues. I'm just reflecting over my next situation where could be this evening, right?
Yep.
If I'm working, when because I'm actually on shift, and so like it could be this evening, it could be tomorrow evening when I'm working next. That uh, like the, once the decision is made, that's just move forward with the decision and don't make the family second guess themselves. Because now you're like, wait a second, what do you mean there's more that we can do? And they were talking about cracking open the chest and doing just very, very aggressive measures that were just not appropriate. And I just can't imagine going through that. You know what I mean?
Totally agree. And those are the stories in my role that I hear all the time. Even, years later, I just had another family meeting for a granddaughter who lost her grandmother and was still going through the grieving process of, first of all, making sure, she wasn't second guessing herself and she honored her grandmother's wishes. But then again, like with some of this very same dynamics that we experienced with this family, was just things that stuck with her to say, wow, did they realize what was going on and how hard this was on the family to witness some of these interactions and communications and behaviors still stuck with this granddaughter 3 years later. So it
Three
is
years later,
how
wow.
it is powerful, the impact our behaviors, our words have with our patients and families, especially, at the end of life and making those hard decisions.
And so to as your role as a patient experience, head of patient experience and a patient advocate, what advice do you have for clinicians like myself and those who are listening about how can we do it better to make the family's experience of someone at the end of life? Because it's really important for me to make sure my patient is comfortable. I want my patients to have a good death. I want
Yeah.
them to, if death is inevitable, I want them to have a comfortable death with the family surrounded by them and maybe their spiritual needs met, which was not met in this case. They didn't even ask if they wanted a chaplain, which is another problem, right,
Yeah.
that they complained about. So that's what we focus on, right? Patient is in the
Yep.
center of everything we do. As
Correct.
so, but there's all I think we don't think of the family enough. So what advice do you have for clinicians in a situation like this?
Yeah, in a situation like this, again, time permitting, it's really to bring everybody around so we can have an honest but very compassionate conversation, obviously, about the state of their loved one. What are the options, you know, pros and cons, risks, but ultimately, to what you said beautifully earlier on, what would your loved one want in this situation based on everything that we've just laid out? And okay, based on that, this is what we see as the best, a course of action here to, again, have a dignified passing, but include them every step of the way. And really, now it's, since the patient can't be at the center of their care any longer, that's where the family has to be at the center of the care, and really, processing it with them. Again, this is what we're seeing. You mentioned over and over again that, your loved one doesn't want any heroic measures. Here's what we're seeing, and here's the best way to keep them comfortable. What do you think about this? Do you have any questions? What other resources would be really important? Because, yeah, to your point, this isn't a finger pointing exercise. This is very difficult for clinicians and all of healthcare staff witnessing this happen. And people deal with this in different ways. They either get really serious or they might try to make light of it. And that's a lot of time just to relieve their own pain. And we know witnessing over and over these types of situations takes a toll on the healthcare clinician and the entire team. But I think at the end of the day, what's really important is, if they're struggling, what other resources? And you mentioned a great one. We're talking about, spiritual or pastoral care to come up, because a lot of times they can process this situation with the family and really help them think through and make peace with it. Obviously, if there's a spiritual component, they can pray with them. Also, we've got, hospice care that provides more than just end of life, but they provide a lot of other support. So it's raise the flag, see where you're at, do that gut check and involve others to really support everyone going through this process.
And I think, going back to that burden of guilt, what I say to families is, if, for this case, if your mom was standing where I'm standing, and I'm assuming I'm at the bedside, if your mom was standing where I'm standing and saw herself in the bed, what would she say?
Yeah.
And that I found that way to frame it just relieves that burden of guilt and makes it easier for them to say, she would never want this, or he would never want this. I said, sometimes I'll say, if dad saw himself, would he punch me in the face? And that leaves them a little bit of a, makes them chuckle. And they said, absolutely, he would. And so
Yes.
they know the answer. And then I say, then you're just speaking for him. You're not doing it. Dad is speaking. You're just speaking for him. So
Yes.
don't bear that burden of guilt. I found that be so helpful, because otherwise people feel that they're killing their loved one.
Yeah,
When they're not, they're just honoring their wishes.
that's right. So beautifully said. And just the other fact from a cultural competency perspective, from a cultural perspective, and values and all of that, find out what other items would be important in this entire process, and make sure we're honoring those as well, because a lot of times the family will feel respected once we include what's important to their loved one and to them from either a cultural or a spiritual perspective. It's different. The entire end of life and passing process is different from culture to culture, religion to religion. So the more you can, activate the resources to respond to those, then it again really dignifies the passing of their loved one and feels like the healthcare organization supported them in this very difficult decision.
Yeah, yeah, those are very important points, and I just wanted to kind of get together with you and debrief further so that we can learn from this, and
Yes.
and we're honoring the wishes of the families, which is why we ask permission to retell the story so that others can learn from this experience, to just not forget the family. We focus on the patient, and that's always the most important, and we have to be cognizant of that we are being watched closely by the family. And there are some families that are very difficult, that they actually hinder care. And I'm sure
Yes.
you've seen that in your career and experience, right?
Yes, absolutely. Yep. In fact, we're dealing with that situation. So that's, as a healthcare organization, always keep the patient at the center of their care and express our concerns to that family member. And what I found is, what is our mutual goal here for your loved one, and try to get them recentered on that mutual goal, and then show them how their behaviors might be, counterintuitive or contradictory to that, in a way that is not, first of all, letting the medical team do their job, and secondly, getting the care for their loved one, which that's why they brought them into our care in the first place. So it's constantly redirecting them, but letting them know that sometimes we'll have to take extreme measures to limit your, decision making, limit your visitation, which sounds very harsh, but we have to protect the patient at the end of the day. And those are very, very difficult conversations, but it's being totally transparent. It's like, can we get other family members involved here? Because it sounds like this one is taking a toll on you, and you might have been the caregiver, and you're just trying to make sure everything is done the way you did it at home. But now it's a different level of care or a different intensity. Can we involve others to take the burden off of you? Because our first priority is your loved one, and doing what we know to be best medical practice in their scenario.
Yeah, and I love how you said that, to remind them of our mutual goal. Like, so your goal and my goal we're aligned. We want to take care of your loved one as best as possible, and and this behavior that we're seeing from you is really getting in the way of that. And I know you mean well, and we want to take care of your loved one. Please, we want you to understand that this is hindering the care. And I love how you can remind of the shared purpose, right? Of when you have a crucial conversation, you want to the shared purpose of what we're there for. So, because a lot of times it quickly becomes adversarial.
Yes.
Right?
Totally agree. And then it becomes about everything other than their loved one's care. And that's the hardest part. Once other people get involved and third parties, it can go down this whole route, but it's really continue to refocus everybody on the care of the patient at the end of the day.
Absolutely. So hopefully we can take these lessons to heart, and I can remember them going forward. And I'm hoping we can honor this patient and her family, and we thank them for allowing us to share their story so that others can learn and be better. Dominic Quezada, thank you so much for your time today.
Thank you, Doctor. Really appreciate all the work you're doing.
Thank you.
Take care.
Thank you for listening. To get every episode delivered directly to your inbox, please subscribe at healthcaremusings.com.